afternoon and welcome to another Institute of Health Studies satellite seminar. We are broadcasting from the University of Plymouth, and in the studio today we are very pleased to welcome Matt Lobley and Martin Warren. They will be giving a joint presentation under the general heading of the health of rural communities. First, Matt Lobley, who is a Senior Research Fellow at the Centre for Rural Research at Exeter University, will talk about one of his recent studies. This has been based on in-depth interviews in North Devon examining some of the social implications of recent agricultural change. Although his work has not focused specifically on health, we will be able to discuss some of the implications for the well-being of farming households. Secondly, we have Martin Warren. Martin is Head of Land Use and Rural Management Department here at the University of Plymouth. His current research interests include the use and barriers to use of information and communication technology by farms, rural businesses and rural communities. Although health has not been the focus of his research either, work by others, including myself and David Hannay in Scotland, suggests that the use of the telephone and other forms of virtual support may be important in the maintenance of mental health when subject to such trauma as the foot and mouth crisis. In the studio to discuss the presentations by Matt and Martin, we have three people. Sheena Osana is Principal Lecturer in the Department of Social Policy and Social Work. Much of her work has been concerned with issues of health service need, health service provision and resource allocation in rural areas. Secondly, we have Man Chung, who is Principal Lecturer in the Department of Psychology with a particular interest in post-traumatic stress disorder. He has been discussing possible research into adolescents in farming families that suffered from the foot and mouth crisis. Our third guest in the studio is Paul Farrand. He is Senior Lecturer in the Institute of Health Studies with particular research interest in health psychology and mental health. And lastly, you have me. I'm Ray Jones and I'm Director of Research at the Institute of Health Studies. I've got an interest in the use of ICT to support mental health in rural areas. What we will do in this next hour is first Matt and Martin will each give a presentation for about 10 to 15 minutes. At the end of the two short presentations they will join us again here for discussion, and that will be your chance to contact the studio with your comments and questions. There are two ways in which you can contact the studio, and details of these will appear on your screen in a minute. I'll tell you again after the presentations, but if you've got a pen and paper handy, you should make a note of them now. You can phone in using your mobile or any other phone available on 01752 233 646, or you can email tvstudio@plymouth.ac.uk. So now we go over to Matt Lobley.
Thank you. I'm going to be talking about some of the headline results from a project we did in North Devon called Farmers on the Edge. This project was looking at the adaptive strategies of farm households, and although we weren't specifically looking at the well-being of farm households, the results have a number of implications for farm household well-being. Just to give you some background to start with, in recent years, farming in Britain has gone into a recession that's seen farm incomes fall to their lowest level since the 1930s. And so farmers have been facing severe economic difficulty. There have also been problems with animal disease, BSE and most recently foot and mouth disease, where over 2,000 cases of the disease were recorded and about 50% of farms had movement restrictions on them, and all farmers and farm families lived in fear of the disease arriving at their farm. At the same time, farmers are facing up to quite significant changes in policy, the way that support for farmers is delivered, and an implicit redesign of the social contract between farmers and wider society. So all of these factors are creating uncertainty and worry amongst the farming community. Then if we look at evidence from the USA and the farm crisis in the 1980s, there were lots of indications to suggest that the people in most economic difficulty became very isolated. They became socially isolated, they stayed on the farm, and they didn't have those sort of social buffers that helped protect many people. And so these were the sort of ideas that informed our research. So just to say something about what's happened in the recent past in our study area in North Devon. First of all, the cohesion within the farming community has eroded in many ways. There's been a loss of reciprocal helping, where farmer would help farmer. This only happens now in emergencies. Where farmers do work with other farmers, it's strictly on an economic and contractual basis. There's been a collapse in the membership of the National Farmers Union. Once this was seen as near compulsory. The Farmers Union represented farmers, it was for the good of farmers. There's been a complete collapse in membership now as farmers in the area felt that the union didn't represent them or their best interests. There's also been division emerging within the farming community surrounding some of the contemporary debates in wider society. So, for example, the hunting debate is causing division within the farming community in just the same way as it is within wider society. Debates over supermarkets, GM foods, all of these issues are helping to erode the cohesion within the farming community. Then, when we look beyond just the farming community, we can see a change in what we call the wider social role of farmers and their family members. In the past, many had held positions as school governors, on the parish council, and so on. Now there's a marked decline in that sort of civic participation in wider rural society. And when we asked farmers specifically, do you know the names of all of your neighbours? Everyone said yes, but apart from the non-farmers. They didn't even know the names of their non-farming neighbours. And again, this points to a change in the role of farmers and them becoming isolated from wider rural society. So we then went on to look at how people were actually adapting their businesses in the face of all of these changes. Some people were specialising in a particular enterprise. For example, dairy farmers working very, very hard, very, very long hours to try and make their business successful. Other people took a different route. They diversified. They went into other enterprises. And here, particularly, the role of women was important in providing alternative income sources. Finally, though, people were risk-averse and essentially belt-tightening. They were not taking on any debt, they were avoiding any risk, and they were cutting back. So what does this mean for well-being? Well, there are lots of examples of increased social isolation. Farmers enter in a sort of holding pattern where they didn't go off the farm, they didn't spend money, and they were on the margins of information flows and ideas. They were out of the loop, as it were. They weren't aware of some of the more successful strategies that could be adopted. We didn't find any examples of extreme poverty. So we didn't find any examples of people unable to meet their basic needs for sort of food and shelter. But there are lots of examples of going without. People were consuming their savings. They were cancelling regular payments, and sometimes this included insurance payments and pension plans. They were redefining their material needs down to a lower level. And also we found evidence of not just economic vulnerability, but family vulnerability. So for any business to survive, it has to renew its business capital. And you could argue that for a family business to survive, it needs to renew its social capital, its links and associations with wider networks. And there was evidence that after foot and mouth, in particular, the social capital of farmers in the area wasn't being renewed. They'd got into new patterns of behaviour that involved them staying on the farm a lot more, and that was continuing now, even though foot and mouth is over. So what are the implications for this? As I said, we didn't set out to look at well-being in particular, but these headline results do suggest some implications. Clearly there's a need for a more sophisticated analysis with the use of well-being indicators to look at what's happening in farm households. But also there's the issue about differentiated impacts on well-being. We can talk about farms, but most farms in this country are family farms. There's a household that lives on the farm. What we don't know yet is how different people within that household are affected by some of these issues. How is the well-being of younger children being affected compared to, say, their parents? Equally, we don't know the differences in the impacts on well-being between different farming situations. How are people who have diversified, who have significant other income sources, how are they affected compared to people who are dependent for their livelihood on farming? And particularly important with the way in which policy is changing, we need to investigate the link between well-being and business strategy. Increasingly, farmers are being called upon to become rural entrepreneurs, to manage a portfolio of different businesses. One hypothesis could be that in order to be able to do this, they need to have good levels of general well-being. And yet there's no research being carried out at the moment to look at the link between these two. Our evidence suggests that people who are suffering economically have low levels of well-being, and therefore they're going to find it difficult to take advantage of some of these new policy initiatives. Finally, there's the role of social networks and examining just in what way people with wide social networks differ in terms of the ideas that they can bring to the business, people that they can turn to for support. And now I'll hand over to Martin, who is going to say something about the internet.
Thank you, Matt. Ray has already mentioned that my work is not specifically related to health, but my research focuses on the use of information and communication technologies, or ICT, does allow some reflection on matters pertaining to healthcare in general and relating to the well-being of rural communities, which Matt has been discussing just recently. And I've mentioned some specific projects here relating to farmers in the internet, village websites, the Buckfastleigh Broadband, which is a project relating to supply of broadband to rural areas, and so on. What I would like to start off by doing is just looking briefly at the potential of the internet. The internet, which is primarily email and World Wide Web, has the potential of helping to overcome some of the consequences of spatial dispersion of people and groups, so that people who would otherwise be cut off from sources of information, from interaction with others, from transaction opportunities, can, with the right facilities, be part of the wider world. And we can think of things like access to statistics and other information sources for farmers. We can think of Amazon, Tesco online for transactions. We can think of news groups such as Farmers Weekly Interactive to help people engage in chat rooms in discussion between themselves. Applied to healthcare, there is obvious potential for the provision of general healthcare information, for specific information, and by that I mean specific to the individual possibly, and or to a particular condition. And here we have a link with Ray Jones' own work in terms of mental health and so on. Contact with fellow sufferers, which can be helpful, but can be a two-edged sword. And of course, support for practitioners who are out in the world, in the rural environment, trying to cope with healthcare issues. The penultimate point on this slide reflects a wild thought, perhaps, that given the tendency for men to be more reluctant than women to consult on general health matters, the very impersonality of the internet and its appeal to males, in particular, boys' toys factor, might well be a secret weapon. Partly as a consequence of its ability to overcome spatial isolation, the web can also potentially help with social inclusion, facilitating contact through, for instance, adding value to existing networks, helping to create new social networks wider than the immediate locality, and meeting new virtual neighbours along the way, broadening horizons generally. So this relates to some of Matt's work. Engaging in social activity, and I've already mentioned chat rooms, news groups, and so on. All of this, I think, has some relevance to Matt's points about erosion of cohesion, decline in civic participation, etc., and the consequential impact on well-being of people and communities. Now, much of this will be obvious to you, and indeed, I think, given this audience, you could probably tell me more about the potential than I can tell you, in fact. But the gap between potential and reality is huge. We have something which could be enormously valuable, but for instance, my work with farmers and adoption of internet shows relatively low rates of uptake, and we're talking about, say, 26 to 30% of farmers using internet in their business and their personal life, for instance. and that's reflected in other statistics relating to rural communities. More importantly, within communities, slow adoption is associated with certain specific groups. For instance, the ill-educated, the elderly, the poor, creating so-called digital divides between the haves and the have-nots. The causes are varied, and I picked out 4 particular ones here: financial, technological, human, and relevance. And I want to say a little bit about those and the attempts to overcome those problems. The causes are partly financial, capital cost of buying computers, modems and so on, and operating costs, the phone bill, etc. They're partly technological, and most initiatives attempting to raise adoption levels have concentrated on remedying the latter. For instance, creating telecottages, so-called, for allowing access, wearable interfaces, so much more accessible interfaces with the internet, improving telecommunication structure in rural areas through broadband initiatives and so on. However, it's clear from our research and from other studies that development of human potential is crucial. Firstly, building confidence in the new medium and in using computers, and secondly, in developing ability to use the technology, even at the really most simple, low level. Without this kind of development, you can provide all the technology you like, but to little effect. This is a matter that is still underestimated after all this time by technology providers, on the one hand, and policymakers. They tend to project from their own experience and own competence, and forget just from what a low level of confidence and ability most of the population still come. And overcoming that problem is particularly difficult in rural areas because, by a delicious irony, we still need people to go round and train people or develop that potential. They need actually to travel round before they can use this global virtual medium. There is much to be done in this area, and I'm happy to talk about some initiatives. Another issue is relevance. People will not use the World Wide Web if they don't have confidence that they can find information or contact with others that's relevant to their situation. And a subset of this is localness. In my work with farmers, a recurring theme is their desire to use this global medium in a very local context, and it's reasonable to assume that this attitude is shared by others in rural communities. Focusing on relevance, a phenomenon which has been quietly growing for the last 3 or 4 years, relates and relating to and growing from the locality, is that of the village website. Ongoing research conducted with Dr. Sarah Skerrett at the University of Newcastle is creating a picture of a very lively bottom-up facility created in the main by dedicated individuals, I do mean individuals, one-man bands, within village communities with very little financial backing and no direct support from government or other agencies. The form and content of these websites usually reflects their genesis, with an emphasis on providing a showcase for outside visitors and a notice board for residents. I'm showing 1 or 2 examples here, but it will be a quick flick because the print's too small, but I would recommend going through the web and just putting in a search engine looking for some of these village websites. So we get a little flavour from these about the websites and the kind of perceptions that they're trying to induce in the reader, in the user. Rarely is there any link with health services or indeed any reference to health. Thus, while these sites may have a role in creating and maintaining well-being, especially where there's some opportunity for interaction, they may also represent an underused resource in health terms. To what extent this is a consequence of failure by health professionals to recognise the potential or to overcome the institutional barriers, or, on the other hand, a lack of concern by those who operate the websites, is an important question. There's little doubt that, in my mind, that this is an important challenge for healthcare services. Thus, in sum, internet-based communication appears to have much to offer in the delivery of healthcare to rural areas, both generally and in the context of initiatives such as village websites. In addition, it's a reasonable hypothesis, though untested, that access to and ability to use the internet technology can help in the struggle to recover well-being in depressed rural areas. But much depends, in my mind, on the development of human capability. It would be very dangerous, though, to think of such facilities as wholesale substitutions for conventional delivery. They rather offer opportunities to enhance existing services and/or to free up some parts of conventional delivery in order to allow its redeployment on specific offline sectors of the community.
Great, thanks very much indeed, Matt and Martin. Martin will be just coming around to join us here in a minute. I wonder if I can actually kick off with a question to Matt. What's the age structure of the people that you've, the families that you've been interviewing? Have you got many older people, or?
Yeah, the age structure varied quite significantly. We had examples of quite young couples with very young children, all the way through to farm households that were multi-generational, so where there were parents in their 60s, 70s, the sort of current generation of farmers, and their children as well. So there was quite a mixture.
Okay, I forgot. I'm supposed to remind everybody that now is of course your chance to phone in or email us. The telephone number is on your screen now. It's 01752 233 646, or the email is tvstudio@plymouth.ac.uk. So do please start to phone in or email us with your questions and queries. And I know that there are people out there in Plymouth and Exeter and Cornwall, so do get your phones out now and start phoning in. Back to that, I was so wanted to jump in on that, because I know that Sheena's got a point that you want to, about the sort of resourcing of health services and this whole issue to do with the older people in the rural areas, but also this age structure is quite a tricky one, I think. Sheena, do you want to?
Yeah, no, I was really sort of pleased to see sort of evidence of some research that's challenging the rural idyll, if you like, and the fact that everything is so wonderful in rural areas. Part of me worries, however, about an approach to rural health that again sort of selects out a particular group, a very sort of relatively small group now in rural areas, as a sort of key health problem or health issue, because I think it can detract attention away from the sort of broader issues that are affecting rural communities, particularly in terms of the sort of age structure of rural communities, but also in terms of the additional costs of providing health services, which are simply not acknowledged in resource allocation formulae as well. So part of us wanted to really ask you about that. It's more of a sort of philosophical issue about whether, what are the implications of focusing on key groups.
Yeah, I mean, this particular piece of research was focused on farm households because that was the idea. I think there'd be great merit in carrying out research of a similar nature across the rural community, and in fact that was our initial idea. We just couldn't get the funding. Obviously it makes it a lot more expensive, because one of the ideas was to look at the ways in which different types of people from different occupations and that sort of thing were reacting to a wide range of changes that were affecting rural areas, not just the farming change. So I think this sort of research makes a start, and hopefully we can build on this and take it further. Having said that, obviously this was in the wake of foot and mouth. Farmers, not just farmers obviously, but farmers in particular had faced very, very significant difficulties. Sometimes they'd seen herds being destroyed that had taken generations to build up. So if you fail and you're a family farmer, you feel you're failing yourself, you're failing your parents, perhaps their parents, and the yet unborn, the children that you would be hoping to pass it on to. So I think these people had faced really significant difficulties, and so that was justified in looking at how these people reacted. But I do take the point that there is a need for broader research across rural communities.
Isn't there a need, though, to dispel the notion of a rural community totally and look at similar groups within rural communities? Because what you're seeing potentially is rural communities per se are breaking down, because a lot of rural communities now, you have an inflow of quite relatively affluent middle class people, because they're the ones who can now afford to live in the rural communities. So the second, third or fourth generation families of traditional rural communities are having to move out. So rather than saying the interesting entity here is the rural community, you should be looking at groups of vulnerable people within rural communities, and it seems that certainly farmers and farming communities seem to be vulnerable in terms of their health, and potentially older residents, long-term residents of rural communities may be vulnerable as well. But certainly there are non-vulnerable groups within rural communities, so just to target the community per se with any form of intervention would be a misallocation of that funding as well.
Could I pick up on that? Because I think one of the problems that you get, if you looked at a city as a whole, you would have groups who are extremely affluent and very, very well off, and you have people who are extremely deprived. But as we all know, in cities, people tend to spatially segregate because of differences in house prices, whereas in rural areas you get that real mix. So I think in terms of sort of, yes, one can identify particular groups. To a certain degree we are talking about a heterogeneous community. It's a changing community, but it is still a community that you can't start to separate into different spatial bits. The second thing I'd just quite like to pick up on is this notion of it's the indigenous who are the poor. I think many people sort of move on retirement into rural areas and are not actually quite as well off as all that, and it's a real issue in some parts of the southwest where people who have retired in not only don't necessarily have the income to support a comfortable lifestyle but also don't have the social networks, and that's also an issue. There are wide groups of vulnerable people.
Can we just bring in, we've got somebody hanging on the phone here, so I want to bring them in at this point. So Plymouth, would you like to put your question, please?
Yes, it's Andy Dickens here from Plymouth. I'd like to ask a question to Martin Warren about the second presentation. You mentioned the benefits of the internet for farming communities in terms of sort of chat rooms and so on. We're trying to work out, obviously, it sounded like it was only a sort of 30% take-up of the internet. So what are the alternatives for people who aren't on internet? Because it does seem like quite a valuable resource and with quite a vulnerable group. So what can people, sort of what is offered for people who haven't got internet facilities?
Well, to some extent, because the internet is the alternative to what has already been there in the past in terms of other community types of forums and so on that would revolve around the church, around the village hall, and so on. And as has been alluded to earlier on, we have a different nature. I don't think it's a breakdown of rural communities. It's a changing nature of rural communities which has made those much less important and still less accessible, particularly to groups like the old and so on who have problems with mobility. In terms of alternatives, I think one of the alternatives that has been trumpeted is this telecottage or telecentre idea that you have a computer or two in the village hall or in a specially built facility. And we've had some experiments with that in the southwest in terms of ratio initiative and so on. And that's fine for people who live in the village, but actually they're often people who are already in the flow of the other forms of communication anyway. So even if they're inclined to come out of their houses and go and use these external centres, we're still losing the full potential for those people who are on outlying settlements and so on. I haven't got an easy answer to this. I think a lot of the issues relating to developing this human capital, identifying for people, helping people to identify that there is actually a relevance and a value to them of using this technology, of acquiring it and training in it, and then providing the facility for them to do it in a very user-friendly way. For instance, AgriNet project, which has buses kitted out with laptops, so it goes round to rural communities, parts in pub car parks and that kind of thing. That's the kind of thing I think that one can do to help move this kind of thing on.
Okay, yeah, thank you very much.
Can I pick up on that? Sorry, I'll read you in a minute, man. I mean, what's the sort of crossover between? I mean, in a way, between like Matt's presentation and yours. I mean, are the people using the village websites? Are they farming communities, or are they the sort that Paul's been talking about? The people who are living there, but actually have nothing to do with the agricultural work.
I'd really like to be able to answer that in detail. The the great thing about this is it's ongoing live research, and so it's very vibrant at the moment, but at the same time, picking up the nuances of which groups and so on are using these village websites is another couple of stages down the line.
Right.
In terms of using internet generally, well, I would say about the village websites, my guess is, and this is an intuitive guess looking at some of the responses we've had, that it's going to be more the incoming people, the middle class, it's older people. I mean older than I mean middle age and up, who are running these websites, and consequently they tend to be gearing them to an audience of a similar kind of interest and age range. So the young are another sort of group left out of the process with village websites. But ask me in another 6 weeks.
Right. I might ask you again something else in a minute, but man, you want to get in there?
Just wondering about the another alternative, which might be something like mobile phones or send text messages to people or whatnot using mobile phone. Any sort of thoughts on that? Or?
Something is from the farmers and internet work. This is a longitudinal study. It's been going since we did surveys in 95, 96, 99, and now just the data's just together now for 2003. And just a quick skim shows, I mean, for the first time we asked about texting, and yes, there are, and this is farmers, not just rural community generally, but farmers, yes, they are starting in a detectable minority to use text, which I was quite surprised about. Fax is a crucial thing. It's not got the same interactivity as email and other forms. Mobile phones, yes, being much more used. So my focus is slightly narrow from that point of view, but I think these other technologies have a place. Yeah.
Well, actually, in our department, Department of Psychology, one of my colleagues is actually doing a piece of research at the moment in which people can actually phone in. They use mobile phone. They phone in. They phone a particular number, and then the data will go onto the computer. Okay. So the idea here is, well, instead of interacting with a human being, you interact with a computer. Now, I think in many ways you can, almost like use the computer as almost like a counselor. This is what I mean. You can talk to the computer. The computer can ask questions. How are you, or whatever. We know that in some psychotherapy work now, we do actually some people do psychotherapy work by interacting with the computer. The computer actually asks you questions. You see, then you answer, and then on the basis of your answer, the computer will ask you further questions. You see. So, I mean, maybe for some, that's sort of related to something you mentioned about well-being before. Maybe for some people, the older generations or men in general, because they can't really sort of, I can't bring myself up to talk about my emotion to one particular person, yeah? Well, maybe, using a mobile phone to talk to a computer is an alternative to, a lot of men. But can I also pick up another point that we raised earlier? I think I agree with Paul's point that it is very important to distinguish different, vulnerable groups. Although I also realize that it is very difficult to do that. But I think from a sort of well-being perspective, or from the perspective of studying the well-being of farmers and so on, to studying well-being on the basis of these vulnerable groups is actually very important. It's very important indeed. Otherwise, the data that you come up with would be very much contaminated by what you mean by the rural community. And
I mean, can I come back on that? Because of course, I also would agree that one needs to recognise different vulnerabilities, but I think that one also needs to be aware of the broader context within which one is working, and there are certain stereotypes about rural communities that, and it depends also on the level at which you're working. If you're doing sort of small-scale qualitative work, or you're actually dealing with individuals, then that's absolutely acceptable and appropriate that one would recognise the difference. Unfortunately, a lot of the resource allocation decisions that we make, a lot of the policy-making decisions with regard to locating health services and providing health services are made on aggregate analysis, and that makes it quite difficult when you're you are effectively dealing with large spatial units. Now, the important thing is to highlight the heterogeneity of those units in rural areas, and the fact that, yes, there are very different vulnerable groups, and, and I think most rural health planners are good at recognising that. But I suppose to answer you, yes, I agree, but it depends on the level in which you're working.
Matt, in your interviews, I mean, did you get much comment from the families about sort of foot and mouth and how the families cope with it? In terms of, I mean, was health something that came out? I mean, I know it wasn't specifically something you focused on, but I mean, was it something that actually came out of the interviews? And how do you think that, where did they go for their support? I mean, they went to other farming families, is what you said. Does the health service play any role there? Are we serving their needs properly? Or?
Yeah, I mean, in terms of support, during the outbreak of foot and mouth, the telephone became very, very important. The phone was ringing constantly. People were in contact with each other all the time by phone, to such an extent that people were saying, after a while, we just didn't want the phone to ring anymore. We'd had enough of people phoning up just to make sure we were okay. But for a while, that played an important role. In the area that we were working in, the role of the church was important as well. Now, I don't know how representative that would be of other rural areas, but the church did play an important role for certain people. And also that the health services were quite active. The mental health team in the area were extremely busy and were doing a lot of work with farmers and farm families. A number of people were receiving support from social services for other reasons, perhaps because they had children with disabilities and things. So people were quite often fairly well keyed into some of these networks. But when we talked to perhaps some of the key informants in the area, there was a feeling that there was a lot of suffering going on that was unreported, and perhaps it's because the issue about men having trouble sort of bringing that up, and perhaps it was partly due to the fact that people were isolated and were just out of that support network. So in some cases it was working for some people, but certainly not for everybody.
Did you look at the function that the telephone took, though? Because the telephone can be used for a variety of different mediums. One is just basic information giving, all the way through to some form of social support. And if the idea here is to use, say, the telephone as a means of social support, on the basis that it was being used more, we'd have to identify the fact that it was being used more for social support rather than just basic information giving.
It was for both. It was for spreading information about the development of foot and mouth, where was the latest farm that was being tested, but it was also for social support, and that did play an important role, certainly for a time. And then, as I said, there was excuse me, a number of people who found they just couldn't face that so much support. They were being over supported. So
in theory, did the social support networks actually increase following foot and mouth?
No, that's all dropped off now. That was the interesting thing. It happened during foot and mouth. Right. People used the internet a lot more during foot and mouth. I mean, we have all sorts of data on this that I couldn't report on today. But since foot and mouth, that's all dropped off.
Interesting. And we have a phone call from Anne Humphreys in Plymouth. Anne.
Oh, thank you. Hello. Question, please, for Matt, really following on your current discussion, and it's about the sample of people for your research. Did gender become an emerging issue? And I'm particularly thinking about women in this respect, because you've been referring to men a lot and adaptive strategies, and whether there was a particular issue about women or whether they were able to source support from elsewhere.
Yeah, I hadn't sort of deliberately been referring to men all the time. We carried out interviews where we could with all members of the household, so that would include women as well. In some cases, women played a very important role, particularly where they were working off the farm, and we had many cases where it was their income that was supporting the household and enabling it to survive. But because it wasn't farm income, it wasn't seen as real income. And even the women themselves would downplay the significance of that. And we had cases where we were showing accounts and we could see that it was the income of women working off the farm that was enabling the survival of the whole farm household. And yet they would deny the significance of that because it wasn't real income. So there were differences there. There were also differences in terms of the sort of social networks that women had. They were involved in different networks, particularly those that were working off the farm. They were exposed to a range of different ideas, different contacts, and so there would be a role, an emerging role for women, I think, in bringing in new ideas and perhaps bringing in some of the sort of health contacts that the men might not feel comfortable with seeking directly, but that the women could bring into the household. So there were some quite distinct roles there.
Sounds like Anne's maybe put the phone down. Sometimes it's quite difficult to keep in touch with the phone, and if they have to turn the TV back on again. So can I pick up on this the who's affected thing? I mean, adolescents. I mean, were you interviewing adolescents as well? And then to bring Martin into that as well, are adolescents and children being involved in the use of the website? Because that was one of the interests that Man and I have got here, looking at the mental health of adolescents, how they've been affected by foot and mouth. Can they get extra support by maybe email and other forms of virtual support in that area? I mean, what's your experience of adolescents, and then are the adolescents using the village websites and so on?
Yeah, I mean, for this particular piece of research, we decided to interview what we refer to as the adult members of the household. So that was people over 18. For various reasons, we didn't want to get into dealing with younger people. Although when we take this work forward, that's exactly what we do want to do. So I can't sort of comment exactly on their experience. Although I would say we did some other work with younger people who are members of the Young Farmers Association, and we were looking at mapping their social networks and their networks of support, and we did that by the use of mobile phones, and we began to map their networks by looking at the names that they had in their phone, and then talking about the sort of levels of contact they had with different people. So we have done some work with younger people, but that's at a very early stage.
Martin, are they involved in these village websites and so on?
Not a great deal, no. As mentioned earlier on, the people who the webmasters, if I can call them webmasters, and the majority of them are male. So excuse the gender-specific term there. It's just easier than using webmistresses, which doesn't quite work. But the webmasters were generally 50 and above, and male, and middle class. And the purpose in producing the website is on behalf of the community, and they're very often trying to project a particular image of the community in the village outside, to the outside world, plus providing a service for people within the village, which is usually an extension of existing means of communication, which might be the village hall notice board, the village newsletter, all of which are geared to the older age group. So one of the things that webmasters identified themselves in our survey was that an excluded group from what they were doing tended to be the young. We have one 16-year-old webmaster, and of course he wouldn't be in that kind of category, but it's a general feeling. So I think there's a very important area there for village websites to develop. I think they're quite naive at the moment, and they're at an early stage of development. Coming back to the farmers' work, that we asked about this time about families and children and so on. Not as are they using it in their own right, but are they a medium for helping their parents move into using internet? And not surprisingly, we're finding a high proportion of the respondents saying yes, they do have children and other family members who are users in the family, and yes, it has been a significant influence on them being able to use the internet, having confidence and so on. It does raise issues which may be again relating back to the sort of healthcare issue of who we approach, who we use as we regard as the prime mover, the prime customer. Should we be trying to approach the male head of the household, as it were, or should we actually be looking more towards the spouse? In farming families, usually a woman and or the children, and using them as a vehicle for, and the male principle as a residual. It's not typical in ways of viewing businesses and households in any area, but I think it would be a potentially much more productive way of approaching it.
I mean, from the health point of view, it's in looking at health information and looking after the family's health is often a woman in the household. I mean, it tends to be that sort of gender difference, isn't there?
And there's a parallel here with things like the business. And my work started off with looking at primarily at the farm as a business. But in a family farm, typically, in a smaller family farm, typically nowadays, it's the woman who gets involved with the accounts and the financial management on a day-to-day basis, at least. She might not have any say over what to spend money on, but she's keeping track because she has the financial well-being of the family at heart, whereas the male may be looking at the farm business unit and so on, have all sorts of other different issues there. Of course, the intriguing thing with the technology we're talking about is that it is technology. It does involve capital expenditure within the family. That has traditionally been the preserve of the male principle, along with combine harvesters and tractors and so on. So it's something that often the woman can't influence, but actually is the person most open, most susceptible to new ideas in this area, most as the incentive to get engaged, and yet doesn't have that kind of decision-making potential there.
Yeah. Yeah.
From the the viewpoint of studying the well-being of adolescents, say, it would be interesting to have a look at the say the academic result of the teenagers and the adolescents, comparing the academic results during the foot and mouth crisis, compare that with the academic results now, and it would be quite interesting to see whether or not there are differences, and also to have a look at the say the viewpoints of about the teachers' viewpoints on the behavior of the the teenagers and adolescents. It would be quite interesting to look at that, and that will have a glimpse at the effect of foot and mouth upon the behavioral problems or the mental health problems of the teenagers.
We've got an email coming in from Bodmin, which is asking about the village websites again, and whether they've tried to develop links into NHS things at all. I mean, are the village websites sort of fairly self-contained, or are they developing links to other, like, local providers, to the local GP's website?
Well, they're hugely varied. I mean, some of them are extremely professional, but the impression coming through from the results is that there's not a strong tendency to link into that kind of service. There's linking into more general information services and local businesses, and that's tied up with trying to get some finance and so on. But they do the impression is very much of islands unto themselves. And that's a terrible generalisation, but I think it's nevertheless generally true. I think what's going to happen over time is that there's going to be much more horizontal linkage between those village websites. We may be an agent of that, because we may actually be the vehicle for people realising that there are other people in similar positions, and let's make some links across. And with that kind of link will become sparking of new ideas and new directions for village websites. But I think there's a huge limiting factor, and that is this one-person operation issue. And somehow, if this resource is going to be used as a resource, that one needs to overcome that one-person thing without losing what creates the vibrancy at the moment, which is that individual enthusiasm and motivation which shines through in the responses we've had. They're real enthusiasts. They want something to happen for their village and for the people. The danger is trying to then sort of manoeuvre them into different functions and so on. That one loses that. If they becomes bureaucratized.
Move or die or something, that's it, it's gone.
That is, and many of the webmasters said exactly that. What happens when I die and I'm 70 years old? There's no one else. Or if Fred, I mean, sometimes it's someone mentioned by name, if Fred doesn't take this over, then this will die.
Yeah. Paul, you say you live in the country somewhere. I mean, has your GP got a website?
Not to my knowledge, no.
You're I'm a townie myself, so I wouldn't know that. I was wondering, the GPs, there is a GP, even if it's a satellite sort of surgery somewhere in most villages, aren't there? And most GPs are starting to get websites, I think, and maybe we could try and develop something there.
It actually raises a really interesting issue, because if I think about my own surgery, which has 4 satellites altogether, and these are very much held in village halls and breezy barns, etc. And it's really, in terms of the actual physical location, it's not really the sort of place you expect to sort of set up a sort of flashy website. And it's just part of me, again, I know I'm sort of very much doing the devil's advocate and everything, but part of this conversation sort of raising concerns with me in terms of, I think you're absolutely right that village websites are very much about the history of the village and about some of the sort of the WI and this kind of business and everything. And I worry that we should expect too much of a health linkage, or I worry that these sort of bottom-up, ventures should actually replace something that is statutory, that there are certain levels of standard that we should expect, and that is very much human. When you were talking about computer counselling, again, I'm obviously just very old-fashioned, but
I think we need to look at the whole notion of sort of helping people or doing counselling to people. I think we need to look at all of that sort of carefully, really. You see, it seems to me that if you pick up a phone and call someone, or you use internet and send emails to people and so on, well, what they are trying to do is that they're trying to engage in some kind of conversation, or shall we say psychological debriefing with one another. It doesn't matter if it is a computer, it doesn't matter if you're talking to your partner or someone you don't know on the web. The idea is to share, almost like debrief yourself. It's a kind of reminiscence. You talk about yourself, talk about the feelings, talk about your own situation. Now, by doing that, it's actually helping yourself. Now, to me, maybe counselling is all about that. It's to allow an opportunity in which you can debrief yourself and talk about your own emotions and difficulties.
We have a caller from Plymouth, so can you go ahead, please?
Yes, hello, this is Miriam McMullen from Plymouth. My question is for Matt. Did you find in your data, in the households where the wife had a steady income, were there differences in relationships between the farmer and his wife compared with the households where the wife did not work?
Sorry, could you repeat that again? I couldn't hear it very clearly.
Did you notice any differences in the relationships? I mean, did the farmers admit any differences in stress in their relationships if the wife was working compared with the households where the wife was not working?
We didn't look at that specifically. I think there were differences, and we certainly found cases where the wife worked off the farm all the time, and her partner would be at home at lunchtime having a little microwave meal, and the whole relationship had changed. And we could make assumptions about changes in the nature of the relationship when suddenly it was the wife's income that was underpinning the survival of the business. But it wasn't something that we looked at specifically, so I wouldn't like to say a lot more than that, really.
Okay, thanks, Miriam. You want to come back on it? Is she still there? No, she's gone. Right.
I'm sort of reminded of other work that's being done in the Institute of Rural Health in Wales, which has been looking at farming suicides and things. And one of the strategies that they've been looking at is the use of, for example, health visitors with a farming background, and actually trying to reach out to people with sort of really to overcome, I think, sort of a sense of pride or difference, and really not wanting to seek help. When you were talking earlier, you were implying that the farmers that you were working with seemed to be quite well knitted into sort of health and social services. How would that tie with this approach, which is actually really trying to target different types of support?
Some of them were, although part of our study area has one of the highest rates of farming suicide in the country, as far as I'm aware. But there were also networks run by farmers. Again, this sort of farmer befriending sort of thing, and so that people can talk to each other. And again, I think it goes back to the sort of ideas about the multi-generational nature of farming, the fact that it's a business and it's a family project as well. And so it is difficult for people people from outside always to understand that, and farmers talk a lot better, I think, often to other farmers, and so that sort of thing was going on in the area, and certainly during the foot and mouth time, you know, more and more people were enrolling as volunteers on those sort of farmer-run helplines. The people that we found that were fairly well knitted into, say, social services, that was because of other issues within the family that anybody else could have, had nothing to do with farming. But the fact that they then had that contact with social services was obviously of wider help within the family. But I think it is important, you know, to get farmers talking to farmers as well about these issues.
Do you think, I mean, that in general, that they, if they're to have the health problems, particularly mental health problems, which is what I think, you know, we're interested in with sort of foot and mouth and so on. Do you think the problems that farming families have are in any way different from maybe families in urban areas where, I don't know, it's a different thing, but, you know, maybe they've got failures in economic things, the business is going down the drain, they've got unemployment, just the same. Do you think there's anything that's qualitatively different, or is it just...
I think there would be a lot of similarities. You know, people were reacting to trauma that somebody else could face who loses their shop or their business. I think there are some differences because of the very strong intergenerational nature, the ties with locality and place, and you can say that the environment of the farm embodies the labour and reflects the labour of perhaps several generations of the same family. So you go out and you see a wood, you see a pond, or you see a hedge that isn't there anymore, and, you know, that is the impact of one of your family members who perhaps came before you on that environment, on that landscape. And so there's that issue of continuity and of moulding and influencing their own environment, I think, means that some of the reactions people are likely to have, some of the ways they feel, are likely to be quite different to somebody who's much more sort of footloose and may run a business in one area, then move it somewhere else. You don't get that sort of farming change.
There's another issue too in the city, and if you're living in a depressed area, then you've got much more opportunity for human interaction and just walking around. But within the foot and mouth crisis, that you have the spatial isolation, and also you had all sorts of restrictions on movement and so on. So a lot of the conventional ways of meeting, farmers' auction and so on, totally excluded.
Well, I think we have to call an end to that there. Thanks very much indeed to Matt and Martin for a very interesting presentation. Next week in an hour's time, in fact, we have another seminar here, which is Barbara Katz-Rothman, who's visiting professor from New York, and she'll be discussing tentative pregnancy. Next month, on March the 13th, we have seminars on the NHS University and on communication in genetic healthcare. So once again, thank you to Matt, to Martin, Sheena, Man and Paul, and thank you all to your participation. Goodbye.
Thank you. I'm going to be talking about some of the headline results from a project we did in North Devon called Farmers on the Edge. This project was looking at the adaptive strategies of farm households, and although we weren't specifically looking at the well-being of farm households, the results have a number of implications for farm household well-being. Just to give you some background to start with, in recent years, farming in Britain has gone into a recession that's seen farm incomes fall to their lowest level since the 1930s. And so farmers have been facing severe economic difficulty. There have also been problems with animal disease, BSE and most recently foot and mouth disease, where over 2,000 cases of the disease were recorded, and about 50% of farms had movement restrictions on them, and all farmers and farm families lived in fear of the disease arriving at their farm. At the same time, farmers are facing up to quite significant changes in policy. the way that support for farmers is delivered, and an implicit redesign of the social contract between farmers and wider society. So all of these factors are creating uncertainty and worry amongst the farming community. Then if we look at evidence from the USA and the farm crisis in the 1980s, there were lots of indications to suggest that the people in most economic difficulty became very isolated. They became socially isolated, they stayed on the farm, and they didn't have those sort of social buffers that helped protect many people. And so these were the sort of ideas that informed our research. So just to say something about what's happened in the recent past in our study area in North Devon. First of all, the cohesion within the farming community has eroded in many ways. There's been a loss of reciprocal helping, where farmer would help farmer. This only happens now in emergencies. Where farmers do work with other farmers, it's strictly on an economic and contractual basis. There's been a collapse in the membership of the National Farmers Union. Once this was seen as near compulsory. The Farmers Union represented farmers, it was for the good of farmers. There's been a complete collapse in membership now, as farmers in the area felt that the union didn't represent them or their best interests. There's also been division emerging within the farming community surrounding some of the contemporary debates in wider society. So, for example, the hunting debate is causing division within the farming community in just the same way as it is within wider society. Debates over supermarkets, GM foods, all of these issues are helping to erode the cohesion within the farming community.
Good afternoon and welcome to another Institute of Health Studies satellite seminar. We're broadcasting from the University of Plymouth, and in the studio today we're very pleased to welcome Matt Lobley and Martin Warren. They will be giving a joint presentation under the general heading of the health of rural communities. First, Matt Lobley, who is a Senior Research Fellow at the Centre for Rural Research at Exeter University, will talk about one of his recent studies. This has been based on in-depth interviews in North Devon examining some of the social implications of recent agricultural change. Although his work has not focused specifically on health, we will be able to discuss some of the implications for the well-being of farming households. Secondly, we have Martin Warren. Martin is Head of Land Use and Rural Management Department here at the University of Plymouth. His current research interests include the use and barriers to use of information and communication technology by farms, rural businesses and rural communities. Although health has not been the focus of his research either, work by others, including myself and David Hannay in Scotland, suggests that the use of the telephone and other forms of virtual support may be important in the maintenance of mental health when subject to such trauma as the foot and mouth.
Then when we look beyond just the farming community, we can see a change in what we call the wider social role of farmers and their family members. In the past, many had held positions as school governors, on the parish council, and so on. Now there's a marked decline in that sort of civic participation in wider rural society. And when we asked farmers specifically, do you know the names of all of your neighbours? Everyone said yes, but apart from the non-farmers. They didn't even know the names of their non-farming neighbours. And again, this points to a change in the role of farmers and them becoming isolated from wider rural society. So we then went on to look at how people were actually adapting their businesses in the face of all of these changes. Some people were specialising in a particular enterprise. For example, dairy farmers working very, very hard, very, very long hours to try and make their business successful. Other people took a different route. They diversified. They went into other enterprises. And here, particularly, the role of women was important in providing alternative income sources. Finally, though, people were risk-averse and essentially belt-tightening. They were not taking on any debt. They were avoiding any
prices. In the studio to discuss the presentations by Matt and Martin, we have three people. Sheena Osana is Principal Lecturer in the Department of Social Policy and Social Work. Much of her work has been concerned with issues of health service need, health service provision and resource allocation in rural areas. Secondly, we have Man Chung, who is Principal Lecturer in the Department of Psychology with a particular interest in post-traumatic stress disorder. He has been discussing possible research into adolescents in farming families that suffered from the foot and mouth crisis. Our third guest in the studio is Paul Farrand. He is Senior Lecturer in the Institute of Health Studies with particular research interest in health psychology and mental health. And lastly, you have me. I'm Ray Jones and I'm Director of Research at the Institute of Health Studies. I've got an interest in the use of ICT to support mental health in rural areas. What we will do in this next hour is first Matt and Martin will each give a presentation for about 10 to 15 minutes. At the end of the two short presentations, they will join us again here for discussion, and that will be your chance to contact the studio with your comments and questions. There are two ways in which you can contact the studio, and details of these will appear on your screen in a minute. I'll tell you again after the presentations, but if you've got a pen and paper handy, you should make a note of them now. You can phone in using your mobile or any other phone available on 01752 233 646, or you can email tvstudio@plymouth.ac.uk. So now we go over to Matt Lobley.